Well, are we on? Good afternoon, everybody. I'm Debbie Weinstein of the Coalition on Human Needs. Welcome to a webinar that's a bit different for us. It's a conversation, which seems like a good way both to introduce a very important topic, stronger, lasting, and more equitable economic recovery, and to introduce Sharon Parrott, who has this year become the new president of the Center on Budget and Policy Priorities. Let's see if you can go to the next slide. Are we starting? Right, here's the key thing: how to enable closed captioning. For all of you who need this, please follow the instructions on the slide to enable the captioning. And maybe we'll leave that up for a second. And that's me. So then let's, with the Coalition on Human Needs, and that's probably all we need to see that slide. And, but we do want to thank our generous funders who make all of this possible. So thanks to them for that. And now on to the meat of it. As I said, we want to introduce to you Sharon Parrott, who's this year become the new president of the Center on Budget and Policy Priorities. Many of you know Sharon from her work on anti-poverty policy at the Center on Budget on and off since 1993, interspersed with periods working at high policy levels at the Department of Health and Human Services, and the White House Office of Management and Budget. And she also worked for the District of Columbia Department of Human Services. So she's had a great range of experience in how policies are made and implemented, as well as very broad expertise across issues like TANF and Medicaid and nutrition and tax credits, and I'm sure a lot more. What I have to add is, in my years of knowing Sharon, she always, and with great dedication, has seen these policies for how they affect people. And she's helped the Coalition on Human Needs countless times so that we could be more effective in advocating for people in need. So today we're going to draw on Sharon's expertise again. You have these many years been our queen of webinars. Here we are at this particularly consequential time when a host of extremely important but short-term measures are now being implemented. But when the nation's deep need for a long-term recovery means more big plans have to be adopted. And before we get started, I do get to ask questions first, but we will take your questions at the end. So please type them in the Q&A box. And we're recording this, and we will send everyone who registered the recording, plus links to useful materials. So Sharon, welcome.
Thank you. It's so lovely to be here. Hi, Coalition on Human Needs friends. It's lovely to be back.
Yes, we are thrilled about this. You've been such an important part of the Center on Budget for such a long time. Now you're leading the organization. President Biden is talking about once-in-a-generation initiatives. What do you think should be some of the most consequential initiatives based on what you and the center have learned over the years?
Yeah, it's a great question. Thank you. And thank you again for having me. It's lovely. It's kind of fun to be here. So the first thing I'll just say is that I do think the American Rescue Plan really does set a new standard for how to respond to a crisis and recessions. Obviously, some of the response is idiosyncratic to the fact that this is not just a deep economic crisis, but also a pandemic. But I think that we will look back at the way the American Rescue Plan, as well as many of the measures that we all worked hard on and got in place from last year, really stepped up and said, we are going to respond in a big and robust way, because when we go small, we increase human hardship, we increase human suffering, and we prolong a downturn and we dampen the recovery. So I'm really excited. I know we want to talk about recovery, and I do too, but I want to just take a moment to say that I really do think the American Rescue Plan and all the work that went into it, not just in the last few months, but really since the crisis began, I do think really does set a new standard. I also think that implementation is going to be hugely important. The help that that bill puts forward, that legislation puts forward, has to get into the hands of the people who need it. And so both because that's what's important to actually reduce human hardship. And also, I think that's how, rightly so, frankly, this will be judged. And as we think about what happens in the next crisis or the next recession, we need this to have gone well in order to have that same kind of robust response. And we should all acknowledge that implementing a sort of landmark kind of response very early in a new administration is challenging. So for those of you that have capacity or work with families and can help do that connectivity to make sure people are getting the help that is now available, that's hugely important work for now and for the future. But look, temporary measures can't solve permanent problems. And we have really big permanent needs, right? We have high poverty. We have a systemic underinvestment in people and communities and kids. We entered the pandemic with 29 million people lacking health insurance. And we have gaping racial disparities that have been in place for years and have been exacerbated by the twin pandemic and economic crises. And so that's where the recovery package comes in. It's just a huge opportunity to make what I think of as level shift changes in a range of areas, not changes around the edges, but changes that really take us a big step forward. And that really take us a big step forward towards a more just nation, right? That like our sights are high because the needs are high and because we know how to do this if we're willing to. So just in thinking about what I think are some key elements, and I won't list them all, and so I'm sure to get in trouble, but I do think about them in buckets, although the buckets are not, there's a lot of sloshing around between them. You could put things in multiple buckets, but I do think there is just an enormous need to invest in kids. We underinvest in kids and it shortchanges their futures and it shortchanges the nation's futures. And so that's making the landmark expansion of the child tax credit permanent. It's childcare, it's a number of things. We have to do better by our kids. We also have to help households be able to make ends meet, and not make ends meet, just barely, but make ends meet so they can fully participate in their communities. And so that means making our nutrition programs more robust. And it means really investing in housing. We know that so many households before the crisis and certainly during the crisis struggle to pay rent. It means making work workable for those in low-paid jobs and those who need jobs. So paid leave, unemployment insurance reform, subsidized jobs, and the critical expansion, the earned income tax credit for workers that don't have minor children at home. And we have just got to take the next steps around healthcare. We need to get to universal coverage. And if we can't do that in one step, we need to get a whole lot closer than 29 million people lacking coverage. I'll just say quickly, that really means two things. That means that we have got to find a way to get people covered if states continue to put ideology in front of health and don't expand Medicaid. And we've got to make marketplace coverage more affordable. We took really important steps, temporary steps in the rescue plan, and we need to finish that job, among other things. So that was a lot. I'll stop there.
Yeah, well, that's the thing. There's a lot here and a lot that needs to get done. President Biden, in just announcing his American Jobs Plan, does have some of what you're talking about and not all. Certainly, there are very important physical infrastructure priorities. He increases the care workforce, which is pretty wonderful, I think. He funds job training. You had mentioned that, but it does leave out direct forms of assistance like the tax credits, health care that you just mentioned, paid leave, housing and childcare vouchers as opposed to construction, nutrition aid. Those provisions are supposed to be released later, or some parts of them. Are you worried about splitting up these two aspects of our, need for recovery or infrastructure?
Yeah, so I think if you asked my friends and family, they would tell you that I worry about everything. And so being on my worry list doesn't necessarily mean that it's a small category. Look, I think you could argue lots of different ways about whether or not it would have been better to roll everything out at once, whether it was better to roll them out separately, whether it's good to have a conversation about some of these physical infrastructure, although it's certainly not only that, it's also home and community-based service infrastructure, which is hugely important. And then to have a fulsome conversation about the other pieces. I think you could argue it lots of different ways. We are on the path that we are on. And I will say that, my read is that certainly the White House and many in Congress are deeply, deeply committed to these other pieces, things like the permanent expansion of the child tax credit, things like health, making a really big run at universal health coverage, things like childcare and paid leave. So I do think there is deep commitment there on a set of important things, both by the administration. That's not to say that everything that I think should be in there will be in there, but I do think it will be a pretty robust package when they put it forward. And I do think there's lots of energy and excitement on the Hill for many of those pieces. And so then the question is, how do we make sure that going forward, because it doesn't really do any good to kind of Monday morning quarterback kind of the looking backwards, but going forward, how do we make sure that the things that we think might be in the second package, whether the administration puts them in or whether they're things that people on the Hill decide should be in the second package, don't become sort of second tier, right? They don't become second tier in importance. They don't get pushed to the side when things get hard. And we don't know if in the end, there will be one package, right? One legislative vehicle, or whether there will be two. But I think our job is front and center to continue to make the case about why these pieces are so critical. And they're so critical to the recovery and to a just recovery, right? It isn't about just GDP growth that leaves out, 30, 40, 50% of the population, isn't very set. It's less than not satisfying, right? It's a travesty to have a recovery that is unequal after having a pandemic that saw millions of people struggling to put food on the table and pay rent, and wealthy people not only largely going unscathed, but in many cases seeing large wealth accumulation during the crisis. And so it's even more incumbent that we fix that going forward. And so I think our job is to make that case and to make sure that they stay on the radar screen and don't become a second tier.
That's very helpful. This stuff costs money. And I think you've already been pointing out that to make these kind of investments, you do not have to find a pay for necessarily for every aspect. But certainly it's the president's intention, it's already in his American Jobs Plan, to pay for some of this. So there's two sides to this, and it seems like some of Biden's opponents want it both ways. They suddenly have rediscovered the deficit. On the other hand, they don't want to raise taxes. So I guess as a first step, or part of the question, what do you say to those people who say, oh, well, you're increasing the deficit and you're just irresponsibly passing these costs on to our children and grandchildren? How do you respond to that?
So many ways. So let me start by saying what we have been doing for a very long time is systematically underinvesting in our kids. We've been saddling them with diminished prospects. That has direct implications for kids' futures and the future of the nation, makes our nation unjust, with high degrees of racial and ethnic disparities. And young people who aren't invested in don't get to have barriers and roadblocks put up in front of them that shortchange their futures. So that is the situation right now. We are saddling our children with diminished opportunity. And so what we need to do is saddle them with unbridled opportunity. That's what we all want for all of our kids, right? And the fact is, we know how to do it, and we can afford to pay for it. That doesn't mean that I think if we can't fully pay for everything this year, we should shrink our ambition on the investment side. I don't think that, but I do think that ultimately, to have the kinds of investments that a 21st century just nation requires means that we have to ultimately be willing to have a revenue system that is adequate, that is sustainable, and that is equitable. And we don't have that right now. And this is a very good time to start down a path to build that kind of revenue system that can support these investments. I'm going to get wonky for just a second, because I know you all would be disappointed if I didn't. But in 2019, so before the pandemic hit, after many years of economic growth, revenues as a share of the economy, which is one way to measure sort of how much are you taking in relative to the economy, revenues as a share of the economy stood at 16.3%. In the year 2000, after a strong recovery and years of economic growth, revenues as a share of the economy stood at 20%, almost a 4 percentage point difference in GDP. Boy, Sharon, that's boring. What does that mean? If in 2022, we simply had a revenue system that collected revenues as a share of the economy at 20%, we would collect $850 billion more. That is the difference between 16.3 and 20% of GDP. 850 billion, not over 10 years, in a single year. So the idea that somehow we just can't possibly raise revenues and we can't possibly afford to make these investments that, by the way, much of the wealthy developed world make is just wrong. The question is whether we have the will to do it. So I'll just say a few other things. Poverty harms kids. We've got reams and reams of research that shows that poverty harms kids, and the poverty and the kinds of hardships that come with poverty harms kids. We know that underinvestment in schools, in broadband, in higher ed, in childcare, in paid leave, and in housing, all of that underinvestment harms kids. So does a lack of healthcare, not only for kids, but when parents lack healthcare, kids suffer. So we have urgent needs for investments that really can have a marked impact on children's prospects. So what we have said is that all things being equal, you'd rather have less debt than more debt. And so we should maximize the amount of revenues that we raise in responsible and equitable ways. We should also use responsible healthcare savings that don't hurt people, right? But that squeeze some excess costs out of the system. And if because of politics and whatever, that can't fully pay for investments that we urgently need, that have time sensitivity to them because kids are losing their futures every day, then we should pay for those urgent investments with borrowing as we march down a path over time to an equitable, sustainable, and adequate revenue system.
I'm convinced. Well, this is part of our struggle. And, you know, there's already been some talk, even among Democrats of resistance to, say, the revenue measures that the president included in the American Jobs Plan. What do you think? Can we pass increased revenues, not to fully necessarily offset all of the good things you're talking about, but as you say, to go some of the way?
Yes, 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 yes. We can do it. And the truth is, it's highly popular. The polling all shows that the kinds of revenue raising measures that the president frankly had in his campaign plans and that he's begun to roll out are highly popular with the American people. And I think we should, I think we often look for the bad news in a day. And it's certainly true that some members of Congress have come out and said, well, maybe not this way, maybe some other way, maybe not quite that much, maybe a little bit less. Okay, I don't think anybody expected that the president was going to roll out a large package either on the spending side or the revenue side, and everyone was going to say, that's just exactly what I wanted. Let's do it, right? There's going to be a fulsome debate and there's going to be changes. But I don't hear, certainly on the Democratic side, I don't hear people saying we're not raising taxes at all. I don't hear anybody saying that. And so I think the job, frankly, over the next several months is to keep broadening that aperture, to keep reminding people of how big the investment needs are, how much we have cut taxes over the last 20 years, and how big our racial and ethnic disparities across lines of both income and wealth are. And how much worse it got over the pandemic that had this crazy shape, this kind of crazy shape to it, where we had wealthy people having really large increases in their wealth as other people, as people were lined up for long periods to get boxes of food, right? So there is a lot we can do without hurting the economy, all the rest, to raise revenues for these kinds of investments. But as you say, if we can only get part way down the road to the revenue system we need, we should take that, we should go down that part way and recognize that this is going to be a multi-year effort to get to the revenue system we need.
In the limited time, trying to consolidate questions a little bit, but many of the people on the call, and we hope all of them, will want to be in touch with their members of Congress to convince them to enact this kind of package. In your experience, and here you've seen it from a lot of different ways, the perspective of an administration and as an advocate, what do you think some of the most compelling kinds of arguments or facts would be if you're talking to a member of Congress who might be not so completely enthusiastic right now?
We're going to get them there. Everybody's going to be enthusiastic in the end. Look, I think one of the really exciting things about this moment is that we actually know what works. So for many years, and it was overstated when people said it in the past, but people would say, well, we don't really know how to solve the problems. We don't really know what works. And the truth is, it wasn't right then, but we have this increasing evidence. So we can talk about the fact that we do know what works. And the fascinating thing is that we did a lot of them in the rescue plan, right? We did them on a temporary basis, but right, we know that if we want to reduce child poverty by a lot, we need an income floor below children. We need a child allowance like many other countries have. Here, we've been delivering it through the child tax credit. We know that can reduce child poverty markedly, and we know that kind of income effect has a very positive effect on children. We know that we know what it takes to expand health coverage. We only have to look at a state like Massachusetts that has an uninsured rate below 3%. They're still in the United States, it's still the US healthcare system, but they've expanded Medicaid and they've deepened subsidies in the marketplace. And those two things combined with some, admittedly, other things that they have also done, really makes a big difference So if we want to get people health coverage, we do actually know how to do that. If we want families to have a lot more stability in their housing, not to be facing eviction, not to double up, not to have kids have to change schools frequently because their housing is unstable, we know that housing vouchers work to do that. And so the good news is that we can be on the offense to say, here's a set of things that we agree are bad. We agree that child poverty is bad. We agree that people need healthcare. We agree that people need stable housing. And here's a set of policies that we know work to address those problems. And so I think that is I think those are exciting messages. I don't think they're the only messages. I think there's lots of messages about what happens when we shortchange children's futures in terms of the country as a whole. There's lots of great data about how we can close racial and ethnic gaps. So there's lots of stories to tell. And I think part of the key here is to have a lot of people from lots of different perspectives, including people with lived experience of hardship and poverty and racism, contributing to this debate and telling those stories.
That's very helpful. Well, we've got a few minutes left, and because there are some good questions here, I'd like to go a little bit longer than the half hour, but we'll try not to impose too much on anyone's time. But first, thank you so much, Sharon, for something that energized me and reminds of all the work we have to do together and why it really matters too. So here are some questions. We know that we didn't manage to get the minimum wage increase to $15 in the previous rescue package. And so someone asked, where will the $15 minimum wage fit in with these big, bold recovery packages since they did take it out of the rescue plan?
Yeah, it's a great question. So I don't see a path of doing minimum wage given the parliamentarians' ruling in a reconciliation bill. And so I think the question then becomes, what's the path? So I think there's a path that says, is there a minimum wage increase with a particular, that could get 10 Republicans? It is important to know that minimum wage increases have gotten bipartisan support before. And we do have a number of members of the Senate, the Republicans in the Senate, who come from states that have a higher minimum wage. So it's, I think there is a question about, is there a path that is a 60 vote path? And it probably wouldn't be the path, the actual minimum wage increase probably wouldn't be as quick, and that's a big problem. So, I think there's one question about, is there a path that is a 60 vote path that is an improvement and maybe not everything everybody wants? And then there is the existential, or the big question, I shouldn't say existential, but the big question about a filibuster and whether the filibuster stands. And whether it stands generally, but maybe not for some things, or whether a decision is made that the whole structure is coming down. And I do not have a particularly good crystal ball on those issues, but I think that's the reality given the parliamentarians' ruling for them.
Right. That's right. That's the reality that we're kind of living within. It does not stop the need for advocates to be out there making the case, holding accountable senators who are seemingly opposed. So thank you for that. So here's another question. Do you think the massive destructive forces brought about by COVID have redefined what infrastructure really is, and that health and caring for our citizens have now become infrastructure?
Yeah, it's interesting. There's this whole conversation happening about is everything we want infrastructure? Should we talk about everything as infrastructure, or should we not talk about it all as infrastructure? Obviously, the administration themselves sort of tried to walk a line. I'll leave it to people that are far more expert than I am in messaging about whether, certainly there's a big need for childcare infrastructure that is both, just as an example, there's the supply questions on childcare, and there's the infrastructure of a subsidy system that is big and bold enough that works for everybody, right? You could call that infrastructure. You could call it, frankly, you could call it anything you want if it gets passed in my book. So, I'm a little agnostic on this sort of, should we try to call everything infrastructure or should we come up with different names for it? I ultimately think we have to make the case, right? We have to make the case why we don't want to enter the next pandemic with millions of people uninsured. We want to make the case for why, why for the economy and families to work, we need childcare and paid leave. What a difference it will make if we are able to reduce poverty by 40%, and have a big reduction in deep poverty for kids. And we have to kind of win the argument about those specifics. And I leave it to other people about whether are we slightly more likely to win that if somehow we call it all infrastructure, or does it start to look contrived? I'm not sure. What I do know is that when we talk to the public about the specifics, they like those specific policies quite a bit, right? There's tremendous support for things like childcare and paid leave and expanded child tax credit and earning of tax credit for low paid workers that don't have children at home. These things are quite popular. Housing assistance, people understand what it means to a family when they can't pay rent. And that whatever the big bold heading we put it under may be important, but we have to be able to articulate why those things are so critical for creating a just and equitable recovery in country.
Yeah, thank you for that. It is true. I don't know whether the term infrastructure strengthens our case, but certainly making the case as you have that we really can't get the just economic recovery we need without recognizing that these are basic building blocks of it. That is to say, and the person who asked the question, it's absolutely right. It was demonstrated to us that if there aren't schools, bringing their children into their premises, and if there isn't childcare available, if people with disabilities and people who are aging can't get home care, there's a lot of ability to work issues that get just untenable for people, and that's why women were a much bigger factor in the number of unemployed in this pandemic recession than has often been the case, because they do so much of that care work in their own families. So, these are all vital underpinnings of economic recovery, and all these people who do polling and messaging can advise us whether we're supposed to call it all infrastructure. In a way, it does seem kind of like a human infrastructure. There is a question about all the people who are uninsured, and this is a person who wants to get Biden to support Medicare for all. I don't know if there's anything that you want to say about, as you say, we know how to get more people insurance. How can we make that a really important part of our agenda?
Yeah. So look, I think President Biden, then candidate Biden, wasn't supportive of Medicare for all. I don't know that means that won't ultimately be the direction the country goes. But I guess, just speaking honestly, I think it's not the direction we're going to go this year. And so my own view is, like, there are 29 million people who, they're all the people who don't have health insurance. I'm just like stumbling because now I'm worried, did I get that number right?
Sounds familiar.
Anyway, if not, we will send an email out if I got the number wrong. But anyway, there are millions of people who don't have health insurance, and we shouldn't wait for the perfect to get them health care. So we should take the steps that we can actually get done this year, right? We can get coverage to people who should be who are eligible for Medicaid in recalcitrant states that are not expanding Medicaid, and we can make marketplace coverage more affordable. And perhaps we can do a public option within the marketplace for some groups, right? And if that gets a whole lot more people access to quality, affordable healthcare, I am for it. And then if we decide, if we then determine, well, we could expand the public option, or we could put in a public option, or we could do something else that would get a lot of cost out of the system. Like, I'm for that too, but I'm not for waiting. And so I think the politics of the moment are, we could do a lot to get people coverage, and we should do that. And we should do that without delay.
Thank you very much. I've overstayed the time that we set for this, and gotten to a lot of the questions, not quite all, but Sharon, I do absolutely want to thank you so much for sharing this time, for all the work that you and your colleagues at the Center on Budget are doing to make it more possible to help all of us to advocate for not waiting and getting the economic recovery we need. Thanks very much to everyone who's listening in. As I mentioned, we will send the recording, which you can share around, and some materials that we hope will be helpful. This is the first in a series, considering how critically important a recovery package is to our nation, of webinars that we'll do. We think maybe our next one will be focusing on the needs of children, and we'll do some others after that. So be on the lookout for that. But thanks everyone for joining, and be on the lookout for more from us. Thank you very much.
And thanks for having me. It's been lovely to be here.